Yeah, this is Dr. Gregory Jenkins calling from KHTS in downtown Newhall, California. I'm on the show here with Dr. Judith Curts. She's a certified sex therapist and a doctorate in psychology. So we're having questions today about relationships. And if any of you have questions, please call us in, and we will try to answer them on the phone.
I have a question.
Okay.
Something that I would like to be able to clear up for my patients concerning erectile dysfunction. Patients have asked me, there are different ones to give out. There's the Viagra, Levitra, Cialis, and I don't really know the difference well enough to explain it to my patients, so I'd love to hear from you and help me to help them.
All right. Well, there's about 5, and probably more. The most common 3 that you see advertised is one is Viagra, and the next one would be Levitra, and then finally there's Cialis. And they all work the same way. What they do is the medicine blocks the receptors that are in arteries and veins so that they don't work. So after you take one of the medicines, the receptors close the vein down in your penis and sometimes other parts of your body, and the vein accumulates blood flow. As the artery pumps down there, the blood won't go anywhere, basically. It won't go out, so that you get an erection that way. Viagra is the oldest the oldest medicine, and the Viagra has the more side effects actually, but it was the first one developed, and men with bad hearts can't really use this medicine because it closes off the arteries. So guess what? You have a heart attack. So Levitra and Cialis work the same way, but they have less side effects. The Cialis, I tell patients, I think is the best of the 3 drugs and has the least side effects, and it lasts for up to 36 hours. Now there are some other kinds. So let's say if you were completely impotent and the medicines won't work on you. So there's 2 medicines that I can tell you right now. One's called Muse, M-U-S-E, and it's actually an urethral medicine, and it's a little pellet that you put down inside your penis in the urethra. Then the last one that works for everybody is a small injection in the side of the penis. And if any of you men have seen the ads for like Boston Medical, they're impotence clinics, and men go in there and they'll have an erection before they leave because they give them a little shot of this medicine, and the medicine lasts for up to an hour. So those are the medicines that will all work. Just you have to kind of dance around the side effects to see which one's the best for you.
I'm still a little confused with the injection. Is that painful?
Well, it's a small needle. It's the same size. If you've ever had a tuberculosis test on your forearm, it's the 30 gauge needle, which is really the smallest. So sometimes love hurts. So truth is that you may have to use a little tiny needle. It's only ½ an inch long, and they train you how to use it on the side of your penis, and you inject it into the muscle of the penis, and that causes an erection within 10 or 15 minutes. And matter of fact, some men go to a specialist for a penile prosthesis that you have to pump it up, and the way they test you if you really need it is that they will give you that shot I just told you about, papaverine, and if you do not get an erection, that means you need the implant. If you do get an erection, it's something else that's causing it, and it's probably in your mind. By that time, you probably had all the testosterone levels and checkups with your doctors, check your heart, etc. But the erectile dysfunction where they use the implant is for the most severe people. Even the quadriplegics and the hemiplegics, they will use that, and they'll be able to have intercourse. So there's a lot of medicines out there, and just talk to your doctor and find out which one you think you need, and then after you get a workup for it to make sure your heart's good and cholesterol's good, your testosterone's good, eventually you can try one of these medicines, and it will definitely work.
So I have a question. This is a doctor to doctor. We're going to have a little conference here, folks. So I want to know, with the man that gets the implant, then he goes around with an erection all the time. Is that correct?
No.
Okay.
The newer implants are pumped. They have little pumps, and they put a little pump down inside your scrotum. So what happens is you pump on the little pump on your scrotum, little thing there, and it pumps it up, and then you hold it and it lets it down. They did used to make ones where we're always in erection, and that wasn't comfortable, didn't look good in clothes, etc.
Yeah, that's what I was thinking. So if a couple is lying in bed together and she hears the pump thing going, she knows that he's really wanting to be intimate, right?
Well,
or is there any sound?
There's no noise. It's just like you were squeezing your leg, and you can't really tell.
Okay.
You can't really tell that there's any noise. It just starts getting an erection after, you agree to it.
Yeah, and I'm not even trying to be humorous. These are questions that I've been asked, and I really do want to know.
Yeah.
Cialis sounds good, though. That's the weekend one where you see the couples sitting in the bathtub, right, and looking into the sunset.
I think all the commercials look the same. It's a man and a woman, all different colors, different ages, and they all the same medicine. But the thing about the penile prosthesis, that's actually the only medicine or surgery that makes men's penis bigger. It makes it wider and it makes it longer because the gadget is put in there.
That's interesting. It's good information. One thing that happened a few years ago, I'm sure it happens more than that, is I think we need to caution men not to overdose. There was a story, it was in the news, about a young man, he was 28, I believe, who had a bet with some women that he could make love to them all night or something. So prior to that, he took, I don't know how many Viagra pills, and he died. So, I commented on that on the news a few years ago. So, let's be smart and go by the directions, and certainly not overdose and try to be, king of the mountain or something. It's not going to work, and it could kill you. So
yeah, as I said earlier, what happens is it blocks off the blood flow. So eventually you have a heart attack or a stroke. So you have to follow directions. And I don't know if you know this, but if you're in the market to buy these at the drugstore, they've become so high, so expensive, and what used to be $5 or $6 is now $50 or $60. And all the meds are that way. And I have patients that I write them a prescription, and they'll mail it to another country where the medicine happens to be made, so they can save money.
I've heard of that. A few of my patients have found a website called Blink, and I'm not advertising it, I don't know, but they're getting their medications for a third of what they're spending here. So, medications are just really out of control. If we like it, then they'll raise the price on us. So,
yeah, sometimes the man comes home, honey, guess what? The good news. I get my medicines 1/3 off now, so we have more time for vacation or something.
Good for them.
Yeah.
Good for them. So I'm wondering, intimacy. We talk about erections and we talk about sexuality, but I want to put that intimacy piece in that women are wanting. We can have the sex toys and we can have all of this is how to, and these are the medications we use, but we also need that talking, and that I call it oral sex, oral meaning talking to each other about sexuality. And that's going on everywhere. The show that I did in Beverly Hills yesterday was on talking to each other, and it was on intimacy and libido and how that helps women. And let me just preempt that by saying I absolutely love men. I have sons, I have son-in-laws, I absolutely love men, but men have defined female sexuality for a long time. It's not a good thing, and I think it's not a good thing for men because, number one, they don't know, and for women to talk to their partner about their sexuality, what they like, what turns them on, is so much better. It takes the pressure off men because they're born and they're supposed to know all about female sexuality. Well, guess what, guys? You don't. Not unless, and if your partner tells you, you still don't know about female sexuality. You know about hers. And if she's honest, and I think we went to commercial before, the best time to talk about intimacy and what you like is with your clothes on. It's difficult for a person when they have their clothes off to be vulnerable. You're vulnerable enough right then, so it's pretty difficult. So it's nice, go for a hike, have a picnic, sit outside, and then at least you're not as vulnerable or feeling as vulnerable, and you can talk about what you like and what turns you on, because different things for different folks. One isn't any better than the other, one isn't any worse, one isn't kinkier. Our sexual fantasies, what turns us on, is put into our head at age 4 or 5 during our psychosexual development. Isn't that interesting? 4 or 5 years old. Our sexual orientation, however, I think begins at birth, doesn't it, Dr. Jenkins? That was the latest that I'd heard in the hypothalamus.
I'm not sure about that statistic, because I haven't read about it in such a long time.
Right.
And that's why we're on the show together.
Well, what I have read and what I've studied is that orientation does start at birth. We're born with that. So when there's all this blame and judgment going on, it makes me very sad, because this is who we are, and we should be honored for who we are, even if we're very different from someone else. The fantasies are here in our minds, and I know people have said, "Doctor, I don't have any fantasies." Well, guess what you do? If you let your mind kind of go, fantasies are put into our heads to heal us and to soothe us. And if we can use those and share with a trusted partner, that's a wonderful thing. And I've always said, if you know your partner's fantasy and you're comfortable with fulfilling it, you own them. So, because that's pretty magical. So, one of those little tidbits I like to suggest that we do in my office.
Well, I think that all of us have seen children that are 4, 5, 6, or 7 that are more, for the boys, more effeminate, and for the girls more, butchy, I guess. Yeah. And you'll see that as they go through school. There's actually a very good article a couple of days ago in the LA Times about the transgenders that are, as they really start getting into junior high school and high school, and then there's the social pressures of going on dates and going to proms, and it's a terrible problem for some families, and so I suggest they just, when they start telling you what they want to do and what they are, you have to decide which way you're going to go, and sometimes poor children are mistreated and mutilated.
I've forgotten the suicide rate of children who are transgender, and it's very, very high. It's sad, and it's just not being accepted for who you are. And I know many people say, well, I can't understand that. I would never feel that way. Well, that's right, because that's not who you are. But you really have to respect who other people are and their feelings, because it's pretty painful to be in a world where everyone expects you to be average and you're different and you're not average. And it's sexually, try to put yourself in their shoes and see what that's like. I'm liking so many shows. I spent a weekend in San Luis Obispo last fall with transgender people who are let's see, identify with being transgender. And it's across the board. It isn't black or white, or they say it isn't binary anymore. You can be a cross-dresser, you can not want the sex change because your orientation is different, but you may want to dress and act as you are the other gender. And actually, that feels right inside. And it was so interesting for me to talk with normal average people, not the wealthy ones who can afford all the treatments, but they go through some pain, and they really want to be accepted. And I think it's all about education and ignorance.
Well, at Johns Hopkins University in Baltimore, that was where they pioneered transgender studies and also sex change therapy. 2 years ago, I believe it was, they stopped doing sex change therapy because the suicide rate was so high among the patients who had the surgery, they couldn't justify doing it again. So, another roadblock for the transgenders.
And they're people, folks. They are just like all of us. They see sexuality perhaps in the same or a different way, they want to identify as a different gender, and how nice to accept them and just, treat them like a regular person. I think my friend Morgan Freeman, I'm dropping names, my friend Morgan Freeman once said, "When you stop calling me a black man, you'll stop racism." So when we stop naming people, then we'll stop all of these biases. And I guess I'm on my soapbox, but I think education and permission is the important thing. We're just so happy to be with you and maybe broaden the way you think a little bit.
That's right. So I think we're getting ready to go to a break here. So this is Dr. Gregory Jenkins and Dr. Judith Curts at KHTS 1220 in downtown Newhall, California. We will come right back. Thanks. Yeah, this is Dr. Gregory Jenkins again, here with Dr. Judith Curts. We're at KHTS, downtown Newhall, 1220 on your dial. In the break, Dr. Curts and I were talking about, we talked a little bit about men's libido, and we were talking about women's libido. So, Dr. Curts, do you have any information about that for us?
Oh, you bet I do. As we talked about last week and we continued this week, men can take pills, and we go to the doctor because that's easy. We want them to write a prescription. We take a pill, magic happens. Not always the case. And one of the cases is women say, my libido is down. Sometimes there are many reasons for it, and after you check with your physician and know that it's not anything physical, then you go to someone like me. And listen, don't be afraid to come to someone like me, because I see people for depression, anxiety, for all different other things. So if you're walking in my office, there isn't a sign over your head saying sex issue. There's really not. It's quite simple. I just wanted to kind of normalize that. But let me talk about what I've talked to women about. And there's an old expression, if you don't use it, you lose it. So sometime you may not be in a relationship for a while, or you may be between relationships and somehow your libido goes away. And my suggestion for men and women to keep that going is to self-pleasure, and perfectly all right, and nothing terrible is going to happen to you. What will happen to you is that you'll learn a lot about yourself, what pleases you, you'll feel freer, and you will get that back and get those feelings back. So please don't think if I take care of myself, then when I see my partner, I'm not going to want them. Well, you probably want them more because you're kind of used to that. So if you don't use it, you lose it. Please remember that. I heard from a previous patient of mine by way of email a couple of weeks ago, and she said, "Dr. Curts, the one thing I remember is you said if you don't use it, you lose it." And she's quite a happy woman now. So I think we did some good work. But there's no shame in knowing yourself, and I think you have a responsibility to know yourself and not expect your lover or husband or partner to know what you want. I mean, you've got to be able to take responsibility. And let me say to your partner, really strong, if somebody tells you something, don't shame them, don't ask questions, accept it and say, well, let's see how we can work with it. This is all about fun, and it's all about pleasure. We work hard in our lives. We have so much going on that this should be one place where we can have relaxation and pleasure. If you don't use it, you lose it. Is that helpful?
That is helpful. I'm going to take that into consideration.
Do it.
But I think each week as we go through on this show that more and more people are going to call and ask questions that many times we won't know the answer, but we're glad to research it for you. And I think that you'll see that that we're easy to talk to. So please feel free to call us, ask us difficult questions, ask us easy questions. We'll never judge you on anything like that. So I'm thinking that each week. Maybe if anybody wanted to have an agenda that say we should start with Sex 101 and have them go through chapters, we'd be glad to do something like that. But and if you have any medical problems, please call me. I'll be here every Wednesday at 2:00. And I think that between Dr. Curts and myself, it'll be an interesting, fun hour.
Education and permission, that's what you need.
That's exactly right. So I think we're about ready to wind down this segment, and I appreciate all of you for calling in and all of you for listening. It's been fun here with Justin at the board here, and I appreciate all the work he's doing. So this is Dr. Gregory Jenkins
And Dr. Judith Curts.
On the KHTS Downtown Newhall show. Thank you very much.
Your hometown station.